Welcome to the first AMCI ICD-10-CM Guidelines and Manual Annotation series. This is part 3 of the series on infectious diseases, and we are over the moon happy to be here. And just so you know, this is a glimpse inside of AMCI's CCS private study group. All right, we call it group study group, same thing. And at any time, if you feel like you want to enroll in any of our classes, go to the description and click on the links. That's what we like to call it. All right, so in this 3-part series, we're going to deal with Chapter 1 Guidelines, ICD-10-CM, Infectious Diseases. So in Part 1, we're going to discuss guidelines on HIV. Part 2, sepsis. Part 3, COVID-19. And we're going to show you how to tap the guidelines in your ICD-10-CM manual. But before I get started, I want to introduce you to our instructional team. First up, myself. I'm Mrs. J. I'm the curriculum director at AMCI. Ms. Takima is a lead instructor, and Ms. Eva is a co-lead. And we're very happy to be here. Also, we have a slew of interns. You may hear them pop in and out, and they are amazing. Now that you're all acquainted, let's go ahead and review the goals for today's presentation. Number 1, we're going to review guidelines on COVID-19. 2, we're going to tap the guidelines in your ICD-10-CM manual. 3, test your knowledge by using coding scenarios. And 4, we'll do a review. Now, I have to tell you that we have a disclaimer. If you want to participate in the coding scenarios portion of this presentation and all of our presentations, you may need to know the following because, well, let me tell you why you need to know it before I tell you what you need to know. You need to know it because, remember, I said this is a glimpse inside of our CCS study group, and it's an advanced class. So here are some of the things that they already know. Number 1, you should probably know certain specific diagnosis codes and or category codes on site. For instance, you should know that B20 is HIV. You should know I-10 is hypertension, etc. So this code, I think knowledge of these codes on site, they kind of come the more you practice. And our students have seen it over and over, and it's very repetitive, so they do know it. But if you don't feel slighted or disadvantaged. You will get it. All right? You just may need to slow down the presentation or stop it. All right, number 2, you need to know the difference between a first listed diagnosis and a principal diagnosis. A first listed diagnosis is the chief reason for the encounter. In other words, the diagnosis that was chiefly treated. Your principal diagnosis is the chief reason for the admission after study. In other words, the chief reason a patient was admitted into the hospital. Today, we're going to learn how to annotate your ICD-10-CM manual. In other words, we're going to teach you how to do our technique called TAP. It's an annotation technique for the ICD-10-CM for the guidelines. Now, you might say, Why would we need to tap guidelines in the ICD-10-CM manual? Because they're already there. Because tap is a quick way to reference your guidelines. And you know that it's important if you're taking your medical coding exams because time is everything. Or if you have production standards at work. So, what is tap? TAP is the very first ICD-10-CM annotation technique. It was developed in 2015, and we tap the guideline simplifications from the AMCI's MCG manual into the ICD-10-CM manual. So, we take the guidelines from the MCG manual, well, the simplified guidelines, and then we tap them right back into the ICD-10-CM. Now, if you want your copy, you can just go to the description, click on the link, or go to amcicoding.com. You ready to move on to COVID-19? And don't forget those purple boxes. Study them. It's good. All right, so now we're still in chapter 1, certain infectious and parasitic diseases. We're talking about coronavirus. Remember, code only confirmed cases. This goes against Uniform Hospital Discharge Data Set guidelines that say that it's okay. No, we don't for COVID, and the doctor can just say the patient has COVID or a positive test, right? So the doctor can say it or test. There's no need for a positive test because the doctor can say it. All right. So only code confirmed cases. Now, if the physician documents suspected, possible, probable, inconclusive, rule out, don't assign that code U071. That is the COVID code. And be sure to code the signs and symptoms. If the reason for the encounter is contact with COVID-19, but it's not confirmed, you're going to sequence first those signs and symptoms. Second, Z20.822. All right, and there is your reference. Now here's how you sequence the codes. All right, so you're going to code COVID as principal. If the reason for the encounter is COVID, you're going to sequence that first. And also, if you have other guidelines that supersede these, you will use them, such as obstetrics. All right. So if you have a situation where you have COVID and the reason for the encounter, COVID could very well be sequenced first, especially because if you're being admitted for COVID and you're being treated for COVID, and you're going to see what I'm talking about in a moment. All right, I'm going to the next page. When you have acute respiratory manifestations of COVID, you can have situations like pneumonia in the setting of COVID. You're going to sequence first U07.1, your COVID, followed by J12.82, your pneumonia. Next, if you have acute bronchitis, you're going to sequence your COVID code first, followed by J20.8 or J40. Now, when you have lower respiratory infections, U071, that's COVID, followed by J98.8. If you have acute respiratory distress syndrome, ARDS, you're going to sequence first U07.1, followed by J80. When you have acute respiratory failure in the setting of COVID, you're going to sequence COVID first, followed by J96.0. Non-respiratory manifestations of COVID, you're going to sequence COVID first, and then second, any manifestations. Now, when a patient has exposure to COVID-19, exposure only without symptoms, you're going to sequence Z20.822 first, or the reason for the encounter. So this is asymptomatic. Now, when there are symptoms with COVID, but are COVID symptoms, but no positive COVID test, and they're just exposed, Z20.822, or the RFE, reason for encounter. All right. So when you have exposure with symptoms, it could very well be the symptoms first, followed by Z20.822. It just depends on your reason for encounter. Okay. So it could be either or, but if those symptoms are related to or COVID related symptoms and they have exposure, of course, you're going to sequence your symptoms first, because the guideline just told us that. And this guideline is saying something else. So, but you do have to pay attention to your documentation. Now we're going to screening for COVID-19. Do not use Z11.52 for screening. No, don't assign Z11.52. That's what that guideline says. Now, when you have signs and symptoms without a definitive diagnosis, you code the signs and symptoms. All right, so this is a circumstance where you haven't been exposed to it, but you have signs and symptoms, and you're not diagnosed. You're going to code those signs and symptoms. Now we're going back to unconfirmed cases with exposure. So if you are exposed and you have unconfirmed cases, you're going to code first your signs and symptoms, followed by Z20.822. Asymptomatic individuals who test positive for COVID-19. You don't have symptoms, but you're COVID-19 positive. U07.1, you have COVID. If a person has a personal history of COVID-19, you can go ahead and use code Z86.16. That means a patient had COVID previously, and they could have a circumstance. So here their follow-up after COVID-19 infection has been resolved, Z09, and then Z86.16. All right, so Z09 follow up after resolved COVID-19, Z09. You know what? Let me see something here. Okay, this is correct. Encounter for antibody testing, Z01.84. All right, now we're going to move on to the next. Now we're going to talk about multi-system inflammatory syndrome. All right, so that could occur in COVID-19 patients. If a patient has been diagnosed and they have COVID along with multi-system inflammatory syndrome, you're going to sequence first COVID, followed by your M35.81. All right, for multi-system inflammatory syndrome. There's your guidance. Now, when the patient acquires the multi-system inflammatory syndrome post COVID-19 condition, so if it happens after COVID-19, you're going to sequence, of course, your multi-system inflammatory syndrome code first, followed by your U09.9. Remember, COVID-19 is gone, but they have been exposed to it. Or not exposed, but they recovered from it, excuse me. Multi-system inflammatory syndrome after COVID exposure, you're going to sequence first your MIS, followed by your Z20.822. There's your guidance. Now let's talk about post-COVID-19 condition. These are often sequelae of COVID-19 or associated symptoms. You're going to sequence first your symptom or condition, followed by U09.9 that says, hey, I used to have COVID. And if a patient gets COVID-19 again, you're going to sequence the COVID-19 U07.1, followed by U09.9. That means that they've had it previously, and any manifestations after that. All right. Are we ready? Yeah. We have some COVID-19 scenarios. Here are the instructions. Now, these you'll really need to apply in these next scenarios and moving forward. All right. So, Miss Eva, are you ready?
Sure am. Here we
Thank
go,
you.
coders. You're welcome. Which codes best describe the encounter? A, U07.1, R09.8, R09.81, Z20.822, G35. B, Z20.822, R09.8, R09.81, G35. C, R09.8, R09.81, Z20.822, and G35. D, 107.1, G35. A patient with a medical history of multiple sclerosis arrives to the ED after a coworker recently tested positive for COVID-19. The patient is confident that she has been exposed because she shares an office with the person. The patient also has a runny nose with chest congestion. Due to the patient's medical history compounded by exposure to COVID-19, the physician believes the patient likely has COVID-19 and admits the patient into the hospital. Which codes best describe the encounter? Coders, you have 1 minute.
All right. Let's see how you did. Those answers are still coming through. I love it. I love it. All right. Good deal. Good deal. And some of you are going to have aha moment, and that is what we're here for, right? Right. We're here for the aha moments. All right. First things first, it says we have to highlight our keywords. Multiple sclerosis. A coworker tested positive for COVID-19, and she believes she's been exposed. The patient has a runny nose, chest congestion, but due to the patient's medical history and exposure to COVID-19, the physician believes that the patient likely has COVID-19 and admits the patient into the hospital. Which codes best describe the encounter? So these are my key words. Now I'm going to apply my general coding guidelines. How I do it, I just write down the diagnoses, signs, and symptoms and procedures, and I analyze them. All right, so first we have multiple sclerosis, runny nose, chest congestion, exposure to COVID-19. Now, the next thing I'm going to do, I'm going to get rid of any sign and symptom that is related to any of the diagnoses on my chart. So, runny nose, chest congestion. Hmm, are these two related? I don't know. I don't think so, but we're going to leave them blocked out just for the moment. Okay. Now we're going to go and we're going to look at our guidelines and keep in mind that this patient has been exposed, right? And the doctor says exposure to COVID-19. So this is going to be our principal diagnosis, right? She came in there because she thinks she's exposed. The doctor believes she's exposed, not the multiple sclerosis, right? No, there's no mention of those symptoms. Just saying. Now that we've applied the general coding guidelines, let's go to the pertinent guidelines or the specific coding guidelines. And I like the guidelines for exposure to COVID-19 with symptoms. I like it. Well, let me go back. I like it. They tell us that we need to use this Z20.822. We know we need to do that anytime you have exposure, but this guideline is a little more specific. If a physician documents suspected, possible, inconclusive, right? And the doctor says he believes the patient is likely to have COVID-19. He did not definitively say the patient has COVID-19. So we do not assign U0107.1. In fact, it says code those signs and symptoms. It's telling you code the signs and symptoms. So what we're going to do, we're going to get rid of anything that's coding U01.7 COVID-19. Any answer that has COVID-19 in it, we're going to get rid of it because it's a distraction. And also, we're going to code some signs and symptoms. Yes. So it says if the reason for the encounter is contact with COVID-19 but not confirmed, you're going to sequence first signs and symptoms, followed by your Z20.822, right? So let's get rid of the signs and symptoms from the section that from our general guidelines here, because we're going to code these signs and symptoms, and we're going to look at our code selection, and we are going to select the code that represents the correct sequencing order. And that will be C, because B is coding Z20.822 first. And if you said C, outstanding. You all with me? Everybody with me? All right, we're going to keep it moving. Good deal, good deal. All right, I'll read this one. And Miss Eva, if you can read the next, that would be great. Which codes best describe this encounter? A, U07.1, I27.0, J96.0, R0600B, JU07.1, J96.0, I27.0, C, J80, U07.1, I27.0, and D, U07.1, J80, I27.0. Patient arrives at the ED with symptoms of dyspnea and in respiratory distress. The patient also has a history of pulmonary hypertension and taking amlodipine daily. After testing, the patient was diagnosed with acute respiratory distress syndrome due to COVID-19 and admitted into the hospital. Which codes best describe the encounter? All right. You have 1 minute. Your time begins now. I think you all rocking and rolling. You're rocking and rolling. All right, let's do our due diligence. Our instructions are in the lower left. I'm going to highlight our keywords: dyspnea, respiratory distress, pulmonary hypertension, patients taking amlodipine, the patient's diagnosed with acute respiratory distress syndrome due to COVID-19 and admitted. All right, here are the general guidelines. What we're going to do, we're going to take a look at dyspnea, respiratory distress, pulmonary hypertension, and ARDS due to COVID-19. And the first thing we can do, let's go ahead and eliminate signs and symptoms. We have dyspnea. It is related to acute respiratory distress syndrome due to COVID-19. Respiratory distress, also related to acute respiratory distress syndrome due to COVID-19. So we're going to get rid of those two. And we're left with pulmonary hypertension and ARDS due to COVID-19. All right. So of the two, ARDS due to COVID-19 is principal because this is why the patient came to the ED. Dyspnea, respiratory distress, and the patient was found after testing to have a ARDS due to COVID-19. So what I'm going to do, I'm going to look to see if there's a guideline pertinent to ARDS due to COVID-19. And guess what? There is ARDS, manifestation of COVID. And it tells us that we're going to sequence first U07.1 followed by J80. Can we eliminate anything? Sure can. We can eliminate, well, we can eliminate a couple of things. Well, on site, we can eliminate C because it's sequencing J80 incorrectly. And look at B, J96.0. It's not J80. And look at A, it's got a little bit of everything. So that's wrong too. It's even coding signs and symptoms. All right, so the answer will be D. This is our COVID-19 code. This is our acute respiratory distress syndrome code, and I27.0 is a circulatory system code. We can deduce that it is pulmonary hypertension, and the answer is D. Outstanding. That's right. Somebody said, hey, we can eliminate that C. We can. All right. You guys with me? We got another one. Miss Eva.
I am here.
Thank
Okay,
you.
coders, you're welcome. What is the correct code assignments with POA, present on admission? A, U07.1 M84.459A 5A1945Z. B, M84 459A U07.1 5A1945Z. C, U07.1 5A1945Z. D, M, 84 459A 5A1945Z. 45-year-old arrived at the ED unable to walk with sharp pains radiating from his hip to his lower leg. He also had cough, fever, and shortness of breath. The patient's RT-PCR test confirmed COVID-19. The patient was admitted into the hospital and placed on a ventilator. After 3 days, the patient was weaned from the ventilator and an x-ray at bedside was carried out. The x-ray revealed a hip fracture. What is the correct code assignment with POA? Coders, 1 minute.
All right. So this one was a little much, right? Wouldn't you say? But let me tell you, there are a few things that you can use to help you arrive at the answer. But let's go ahead and highlight the key terms. This patient had sharp pains radiating from his hip to his lower leg. That's why he walked in that hospital, right? We had cough, fever, and shortness of breath, right? Yeah. Also, had confirmed COVID-19. I'm reading some of these notes. Also, the patient was admitted into the hospital, placed on a ventilator. And after 3 days later, the patient was weaned from the ventilator. And then an x ray at bedside was carried out, right? And the x ray revealed hip fracture. What is the correct code assignments with POA? If you want to put the POA in the chat, you can. I initially was going to go there, but there was going to be students who came, so I decided to take it out. So just want you to know that you could use this principal procedure code selection chart, this guideline here that says sequence your procedure performed definitively, and it should be related to the principal diagnosis. Just to let you know, that's one way you can determine the answer. Also, the selection of the principal diagnosis chart. If you can remember the chief reason for the encounter after admission and study. And what is the chief reason for admission? Okay, so that could help you. So we've done number one, we've highlighted our keywords. Number two, let's go ahead and apply coding guidelines by documenting all of these um, um, signs and symptoms. We had sharp pains. I didn't write it here. Sorry about that. But sharp pains radiating from the hip to the lower leg. Okay. All right. Let's say that's number one. Then we had cough, fever, shortness of breath. Right. And we're going to get rid of all of them. Just get rid of all of them. Then we have left confirmed COVID-19, ventilator for 96 hours, and fractured hip. And remember, ventilator is a procedure, right? You all feel me? You all see where I'm going? All right. So, confirmed COVID-19 will be your principal diagnosis because while the chief complaint of the patient were the sharp pains radiating from the hip to the lower leg, and the patient was unable to walk, right? That's a chief complaint, but it is not the chief reason for the inpatient admission. Remember, this patient tested positive for COVID-19 and they admitted him, placed him on a ventilator. So that means that the COVID-19 was chiefly treated and thus the chief reason for the encounter. And also, it is related to the principal procedure or the primary procedure, right? The ventilator. Okay. So we have a few little clues that kind of gave us. So we know that COVID-19 will be our principal. And the guidance tells us to go ahead because it was confirmed. So we will code it. We will also code the fractured hip, also the ventilator for up to 96 hours. Did you all have an aha moment? All of them are POA. Okay, I think I have one more, and then we're going to end it for tonight. Yeah. Yeah, I thought we had more time, but we don't. But we will get more in. I think this is going to last maybe one extra time or maybe not. Maybe we'll just record it for you. All right. Here is the final one. Miss Eva, would you do me the honor?
Yes, ma'am. Okay. What is the correct diagnosis code assignment? A. U09.9 RO6.00, B. RO6.00 U09.9 UO7.1, C. UO7.1 U09.9 RO6.00, D. RO6.00 U09.9. This 45-year-old female patient is being evaluated for chronic respiratory failure. She contracted COVID-19 6 months ago and is continuing to have difficulty breathing. What is that correct diagnosis? Code assignment. Got 1 minute, coders.
All right, good job. Look at this. Look at this. Some of you got it correct, and some, well, you're going to have an aha moment, and that is what we're here for. All right, so first things first, we got to highlight our key terms. Chronic respiratory failure. She had COVID-19 6 months ago, and it's continuing to have difficulty breathing. What is the correct code assignment? All right. So let's go ahead and look at our general coding guidelines. But first, we're going to document the diagnoses. Chronic respiratory failure, COVID-19 6 months ago, difficulty breathing. Can I get rid of anything? Well, maybe the difficulty breathing is related to chronic respiratory failure. And I have two diagnoses here. So which one is principal or primary or first listed? Well, let's see. Well, I have a guideline here for COVID-19 sequela. Yeah. So for a sequela of COVID-19 or associated signs and symptoms. So the chronic respiratory failure is related to the COVID-19 having continued breathing difficulties. So the guidance tells us anytime you have post COVID-19 condition, you're going to sequence first your symptom or your condition followed by U09.9. So we can go up in our answers and see which one follows this guidance. Our symptoms first, followed by U09.9. We're going to get rid of B because it is coding COVID. Patient does not have COVID. They had COVID 6 months ago, and you can't code U09.9 and U07.1 unless you have both. You got to have COVID and have had it before. So B has to go. And C is wrong because the patient does not have COVID. And that leaves us with A and D. And D is the one that's sequencing correctly according to the guidance. So A is incorrect and D is our answer. So that says that chronic respiratory failure is our first listed code. All right. All right. How are you doing? How's everyone doing? Good, good. Well, we're not quite finished because we do have some final things to tell you. For COVID-19, make sure you code only the confirmed cases. This is not the same as this goes against the Uniform Hospital Discharge Dataset Guidelines. Exposure to COVID-19 is Z2 0.822, and unconfirmed COVID, code the signs and symptoms. Don't forget to code those. You're going to code them first. But if they've been exposed, code those signs and symptoms first, followed by your exposure code. These are your key sequencing guidelines to remember. Now, I do want to do something else. I do want to conclude with all right, so here are some takeaways. All right, don't forget to place the word TAP next to your pertinent codes. Don't forget that if there are any, but I know Chapter 1 HIV has them. I know hypertension has it, and we will get to some more next week. All right, and don't forget those purple boxes. They represent your sequencing order, so study them, reference them. They are great. And definitely don't forget your MCG manual. That will give you additional sequencing guidance as well. Now, if you want more coding scenarios, I do recommend the Medical Coding Training Manual and also this 2022 Clinical Coding Workout. Hey, it's not the best, but it is the best that I've seen out there. Okay, so next week, we're going to continue our ICD-10-CM guidelines and TAP instruction, and hopefully this helped you. Somebody said, "Hey, I'm confused with COVID guidelines." You know what? You probably should have been, because they were kind of redundant. They were just redundant. So you really aren't confused. They are saying the same thing, I guess, for it seems like they're saying the same thing. I felt that way with sepsis and COVID. Yeah. All right. So don't doubt yourself. You're good. It's not you. They're just saying it different ways. All right. So I'm reading your I'm reading your you know, people are still responding to questions, people are making statements, and I'm just reading them all to see if there's a question that you might have. And people are saying it was good. Yeah. Yeah, someone said it does seem like they were repeating. Yeah, they pretty much were. But I think people speak differently, and people, I don't know, have different frames of reference. So, like, to me, they were saying the same. Yeah, someone said COVID was new. Yeah, those are new guidelines. They are. They really did expand them. Yes. So I just want to say thank you. I want to thank Miss Takima, who was quiet in the chat. You didn't even know she was here, did you? You probably saw her response in the. She's just working away. Miss Takima, are you there? I guess she isn't. Okay, Miss
Oh
Eva.
no, I'm here. I'm sorry. I was double muted. I was just a talking. No, I'm here. I was here working away. I saw answers in the chat. I saw some good answers from the coders. I think you guys did an amazing job tonight.
They did. They did. Outstanding. And thank you so much for standing by. You're going to hear Miss Takima all next week. I promise. All right, next up, Miss Eva.
Hi, coders. Sorry I was late. I have fun. I hope you guys did as well, and you guys did fantastic. It's a lot of tapping and guidelines, but you'll get it. You'll get it. You'll see. So have a wonderful night and see you all on Thursday.
Yeah, thank you so much, Miss Eva. Miss Eva really helped out with this project, so I'm so grateful to have her. And last but not least, Miss B. She made it over from Thursday Night Live. How are you, Miss B?
I'm good, Ms. J. Hi, goddess. You guys all did an amazing job tonight. Have a wonderful night. Thank you, Ms. J.
Thank you. Thank you, Miss Beachy. Okay, everyone, good night, and we'll see you next week. Take care now. All right, coders, we are at the end of our session, and I know you all were killing the chat with great responses. I am incredibly happy, incredibly outstanding. Shout out to all of you, and shout out to our amazing AMCI interns. Here are our guideline takeaways. In other words, always try to remember them. Number one, code only confirmed cases of COVID-19. Only confirmed. U07.1. And if you know inpatient guidelines, you know this contradicts inpatient general coding guidelines. Number two, exposure to COVID-19 is coded Z20.822. And number three, unconfirmed COVID, go ahead and code signs and symptoms. All right. This concludes part 3. And next time, we will review chapter 2, neoplasms, and this will be part 4 of our series, ICD-10-CM, chapter 2 guidelines. On behalf of myself and Team AMCI, I want to thank you for joining us, and we hope to see you next time. If you would like more or would like to study with AMCI for the CPC or CCS, go to our website, www.amcicoding.com.